topic is preterm birth. Preterm birth refers to a birth that occurs more than 3 weeks before a baby's expected due date. While a normal pregnancy lasts about 40 weeks, a birth is considered premature when it happens before the 37th week of pregnancy. Babies born too early are often called preemies. In a developing fetus, those final weeks between the 34th and 37th weeks are critical for gaining healthy weight and completing the development of major organ systems, particularly the brain and lungs. By the end of this period, the fetus has usually reached a level of maturity that supports life outside the womb. The lungs are among the last organs to fully mature. This explains why many preterm babies require ventilator support during their first days or weeks of life. Premature babies may also face long-term health challenges, including learning difficulties or physical disabilities. Globally, preterm birth, also called premature birth, is the leading cause of infant deaths, with an estimated 15 million babies born too early every year. Survival rates vary greatly depending on how early the baby arrives. At 22 weeks, survival is about 6%. At 23 weeks, it rises to 26%. At 24 weeks, about 55%. And by 25 weeks, the chance of survival is roughly 72%. The earlier a baby is born, the higher the risk of complications. The exact cause of premature birth isn't always clear, but several factors are known to increase the risk of going into labor early. These may include a history of previous premature birth, chronic health conditions such as diabetes, kidney disease, heart disease, or high blood pressure, poor nutrition before or during pregnancy, smoking cigarettes or using illegal drugs, certain infections, particularly in the lower genital tract, being significantly overweight or underweight before pregnancy, conceiving through in vitro fertilization, IVF, multiple miscarriages or abortions, physical injury or trauma, problems with the uterus, cervix, or placenta, less than 6 months between pregnancies, carrying more than one baby, severe psychological stress, such as the loss of a loved one or domestic abuse. Possible warning signs of preterm labor include 4 or more uterine contractions within 1 hour, vaginal bleeding during the 3rd trimester, intense pressure in the pelvis, abdominal or back pain, watery vaginal discharge, which may signal a premature rupture of the membranes surrounding the baby. After birth, a premature baby may show the following signs: low birth weight, minimal body fat, breathing difficulties, unusually pale or yellow-tinted skin, feeding challenges, weak sucking and swallowing reflexes, leading to feeding problems, difficulty maintaining a stable body temperature, poor movement and coordination. Doctors often attempt to prevent premature birth by prescribing medications designed to delay labor. However, if labor cannot be stopped and the baby must be delivered early, preparations are made for a high-risk birth. Once born, the baby is transferred to the neonatal intensive care unit, NICU, where several tests may be performed, including blood tests, continuous monitoring of breathing and heart rate, measurements of fluid intake and output, eye examinations, ultrasound scans, echocardiograms. Treatment generally focuses on supportive care, which may involve keeping the baby in an incubator, monitoring vital organ function, using a feeding tube, providing blood transfusions if needed, replenishing lost fluids, using bilirubin lights to treat jaundice in newborns. Medications and surgery. In some cases, medications are also used to manage complications of prematurity. These may include surfactant to treat respiratory distress syndrome, antibiotics to fight infection, medication to close a heart defect called patent ductus arteriosus, eye injections to stop the abnormal growth of new blood vessels, fine mist or intravenous medications to support and strengthen breathing. In addition to medications, surgery may sometimes be necessary to address conditions linked to prematurity. It is important for the mother to consult with the healthcare team to fully understand the type of surgical intervention that might be required.